My name is DrRic Sigil.
And action. Hey, Jay had a... This is Kirk And action. Hey everyone, it's Dr. Rick. Dina had a question about metabolic flexibility. Well, actually, Dina had a question about how to improve from her plateau. And actually, so did Taz. And that's why I'm bringing this up, is because I've had, Dina's a holistic nutritionist. Taz is just 100% gung-ho with her keto. But yet, both of my patients are hitting the wall, so to speak. But if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. So metabolic flexibility has to do with, I gotta get my model out. So this is a cell. This is a mitochondria. This is a mitochondria. This is endoplasmic reticulum. That's a nucleus. That's a chromosome. This is my son's cell model. This is supposed to be the cell wall. So this is what we learned in biology in grade school. And the way this thing works is the cytoplasm is out here. The nucleus is over here. The nucleolus is over here. That's where the messages are kept, the DNA and the blueprints. And this is where all the magic happens. This is a mitochondria. This is supposed to be the powerhouse of the cell. This seems to be the biggest problem or the biggest controversy about why people are gaining weight. It also is a big controversy as far as why people are bonking. So with the ketogenic movement, started by Stephen Phinney probably 20 years ago with cyclists going keto. That means full fat, no carbohydrate, or at least low carbohydrate. He found that these athletes would be able to perform better, longer, with just taking high fat. And that goes against the paradigm of what we were taught in the 70s and 80s. So this is a faster study. Really good information. But my critique is that the faster study, which showed that if you took high elite athletes and you gave them a challenge on runners specifically, gave them a challenge on a 3-hour treadmill, they compared the performance and the fuel burning of fat adapted athletes and carbohydrate dependent athletes. They found that the fat adapted athletes would be able to do well. They both did great because they're both elite athletes, whether you banked on carbs or banked on fat. But they found a little bit of a metabolic advantage to the fat adapted athletes. And that's cool. But my average patient is not an elite athlete. My average patient is 40 to 50 years of age with about 2 to 3 medical problems. So the question, and overweight. So the question is, and also with 1 or 2 kids, a wife, a lot of bills, a mortgage, and a 50-hour work week. So, and that happens to be me. So the question is, with all that stress, with trying to find a semblance of a sustainable diet that you don't have to spend 3 hours or a PhD trying to learn how to cook, what can you get? So I think we can take the information from our PhD guys, and this is great because there's just a plethora of information on ketosis and keto adapted and all that stuff. But there's still old school information from way back when on how to utilize low glycemic index carbohydrates. So, and there's also good information on how to utilize protein. So that's what I call metabolic flexibility. You have to be able to kind of go between the different types of nutrition practices. So I'll have a lot of people tell me, what is the best, they'll say, Doc, what's the best diet? And I'll tell them, it really depends. It depends on what your budget is, what your knowledge base is, how good you are of a cook, who does the cooking at home, where you are on your medical problems. So I can't just, the one thing that's important is to know that we are in a mindset of growing up. I grew up when it was common to see the commercials on the back of the magazines with milk mustache. I still remember Van Halen, Eddie Van Halen and Alex Van Halen with the milk mustache and a whole bunch of milk on top of them. And that's the kind of culture that I grew up in. I also grew up in having yodels and Twinkies and tearing apart the yodels so you can kind of separate the cream and the chocolate, eating it separately. And so we grew up in the time when foods were starting to be highly processed. McDonald's was a big boon. It was always a treat to go to McDonald's on Sunday. Now it's like McDonald's for breakfast, McDonald's for dinner or lunch, and that's way too much. So and now the processed foods today are highly processed compared to before. So I don't have it here. I probably should have brought it out for the video. I have a steak, egg, and cheese bagel model from 2011 that I have in my office, and it's getting a little dehydrated, but it's still alive. It doesn't smell. It's in my front desk, and people walk by and say, "What's up with the McDonald's thing?" I have it as a little shrine, just as a reminder of what I used to eat. And I have my 10 packs of sugar. What I used to eat with, I used to drink a large coffee with my McDonald's steak, egg, and cheese bagel, and I would think I was happy, but then I wound up with a whole bunch of medical problems. Anyway, so the idea is that if you're really good with your nutrition practice and you're dialed in, but you're hitting the wall, then that's not good. What I would suggest is that even if you dialed it in, so in the case of Taz is right on with her practice of ketosis, even to the point of fat bombs, even to the point of sprinkling a little fasting in there too. And she's tough. In addition to exercise in the form of walking and a little bit of gym work. So you would think with that formula, that recipe, we should be good, but we're hitting the wall with goals. So I have to step back and say, okay, number one, are we truly fat adapted? So she's this one, high fat, low carb. So, and I support her for that. That's not my thing. I'm a vegan, so I'm down here, but I think I'm a good vegan athlete for 56. But with regards to Taz and her keto approach, I have to step back and say, well, are we truly in ketosis? And even if we are in ketosis, are we hitting ketosis properly? Are we hitting fasting properly? And let's look at the subsets. Are we doing exercise properly? I really think that no matter what nutrition plan you have to have some form of muscle building. You have to have some stimulation of muscle, especially my 50 to 60-year-olds. So this is where the high protein comes in handy. I have some following Stuart Phillips over at McMaster University. These guys try to push protein as being the best of the macronutrients to control metabolics or control weight loss. And it's a great theory, and it's backed up by his studies, his thesis, but it goes totally against the high carb, low fat, like with me being a vegan. I'm not necessarily low fat, but that's the work of Dean Ornish as far as reversal of heart disease and prostate cancer. The high fat, low carb community, the ketosis guys, which I think I think the high fat, low carb guys are a little biased in that usually all the information I see is on elite athletes. And I think that that's great, but how does it apply to my average American? And if you're trying to get an average American from a standard American diet onto a high fat, low carb, it's a bit of an adjustment. Now, if you Google ketosis diet, you'll see like bacon and hamburgers and cheese, and I think you'll probably embrace that. But it's not just that. It's really getting rid of or minimalizing the amount of carbohydrates. Carbohydrates, especially if they're complex, are okay, but it's a small amount compared to the amount of fat that you take in, and you're going to get used to it. Again, it's a language, it's a practice, and you have to adapt to it. In fact, it takes about 6 to 8 weeks to get adapted unless you do the keto esters, the ketones in a bottle, MCT oil. Sometimes you can jump straight into it, but most people don't like that adaptation time because it's like a ketosis hangover. Yeah, like you change anything. Withdraw from your good stuff that you're used to, get into the new stuff until you're adapted, it hurts. But it does take a while, and then when it does work and you're adapted, you're purring, and you should see gains in your endurance, in your sleep, in your immunity, fighting infection. But in the case of Taz, she's not. So I had to step back and say, okay, maybe we're not really fat adapted. Maybe we're doing all this majority of diet being fat, but having a little bit too much carbohydrate. Maybe it's stimulating an insulin response. So if we're not really fat adapted and we're eating a lot of fat, but squeezing in some carbs, you're still going to be taking all that nutrient and fuel and putting it right into the liver and putting it into a fat depot. And that's where you'll proverbially hit the wall or bonk. With the keto studies, usually bonking is when you just feel lousy. Your brain, especially your brain runs out of energy when it is used to glucose, and now your brain can utilize glucose or the ketone byproducts of fat byproducts called ketones. But you really have to get used to it first. And when you're used to carbohydrates, it's a tough switch. You can't have it in a time when you utilize and burn up all your glycogen and glucose. You have no choice. You got to switch over. It'll be a rough switch, but you'll get it. And then until the brain just gives up, that's when you bonk. You will have aches, pains. You won't be able to move your legs anymore, and your will to go on will be broken. That's bonking. I really think it's physical and mental. But that's for the elite athlete. For my average person, you're going to have frustration, you're going to have depression, you're going to have like, why I'm doing all this stuff, nothing's happening, or you're going to start gaining weight. Or your walks and your resistance exercise that you participate in will suddenly not notice, you won't notice any more weight loss. You'll notice weight gain, you'll notice tummy size increasing, and you'll notice performance decreasing as far as what you do already. So that's when you have to get some tests. I think that's where data is important. I can get beta hydroxybutyrate, I can get fasting insulins, glycosylated hemoglobins, and a couple other things. The problem with 40 to 60-year-olds is that, especially women, you go through a lot of changes. It could also be that there's menopause or perimenopause that's throwing its ingredients into your recipe. So it's important to take that into consideration. It's important to take in the consideration stress. No matter which practice of nutrition you have, I think that most of my patients will downplay stress and how it affects the metabolics of the body and the mind. So usually, and I've got to that point too, I'm tired of asking, what is your mindful practice? And usually everybody says, well, I try to do yoga. And that's what, once a week? And that's not mindful. If the exercise for muscle is necessary to be done at least every other day, well, mindfulness has to be done every day, twice a day. And it's only a little bit of an obligation, 5 to 10 minutes twice a day, but yet nobody has the tools for it. Some people will say they meditate, and usually the ones that say that meditate, most of the people that I ask and they say they meditate are pacing the room in full anxiety. So obviously the meditation's probably not cutting it. So you really need a coach for that. Usually it's a psychologist that's well versed in mindful practice or guided imagery. Same thing with this nutrition practice. If we're bonking and hitting the wall with regards to, I'm not talking about performance as an athlete, but not seeing any more gains, or with Dina, who is kind of fasting, kind of low carbohydrate, kind of whole food plant-based, but her autoimmune disease is not being controlled or not as best as it could be, I'm saying that's a bonk. And I have to pull back and say, okay, what's the issue? And that's where, again, the 40 to 50-year-old, I try to pull back, maybe get some more information nuggets to see where are we going with this, what's the stress level, is it holiday, did we go on vacation, did something trigger a problem with falling off the wagon? And well, that's the workup at this point in time. But it really takes, because if I was not an integrative medicine doctor and I just had Dina or Taz come in, and I'd say, man, that is awesome. Taz, you're doing keto 110%, you're fasting for 14 to 16 hours. That is great. Keep it up. I don't know why you're not getting any better. If I was pretending to be a colleague. Or Dina, man, you're great. You're taking your supplements. You're doing great with your sleep. You're great for a middle-aged person. You're exercising. I think your autoimmune disease, you're fine. Just keep on watching. Well, I don't just do that. I think these guys are investing so much time, just like you guys, trying to find an answer, that it's important for me to kind of brainstorm. Whether I figure out the brainstorming technique or I ask my friends, my colleagues to get help with the brainstorming, I think it usually is a matter of stepping back, looking at the nutrition practice, and maybe switching it up a little bit. So for Dina, who has been solid with her practice, I said maybe we should think about a fasting mimicking diet. Or Mercola likes to talk about cycling his fat for fuel. I don't know if I agree with him. He does 5 days of high fat, low carb, and then he allows 2 days of carb. That probably works, but for my patients, it'd be to take a break. If you can take a break from the situation, it might be a breather. I know she's raising kids, Dina is, and she's trying to run a business, so sometimes trying to keep a hold of that, that's a problem with high fat, is that it's very tough. Veganism too, you have to be counting where you're going to buy your foods, prepping your food, because you can't just go to a fast food place if you're hungry. You have to have it in front of you, because most fast food places don't offer vegan food or vegetarian only. So that's my problem. And in addition, protein is tough to fit in. If you follow Stewart's information from Canada, as far as hitting at least 100 grams a day or 2.5 grams of leucine, it's tough to fit that into a vegan diet. So I'm constantly having to catch myself putting more and more and more in my fasting window. So it is tough to do this. And then there's the fasting community. Sometimes I will give a break to my beginners. If I've got a young guy that he doesn't really count calories, he's not in control of his nutrition because he lives at home. So and we can't spend that much money. But I just said, you know what? Forget about the macros. Forget about counting. Forget about trying to teach mom. Just put everything into a 8 to 10 hour window, and that's it. And we're going to see what happens with him. But sometimes that'll be all we do is fasting. Or I'll get guys who will fast even more aggressive. Or I'll get guys who are fasting and they bunk too. So I'll put a little sprinkle of an MCT oil before and after when they start their fast, and as they finish their fast, maybe that'll kick them over the edge. So there's many different things to do. That's why I'm talking about metabolic flexibility. Is if you're trying to get as much as possible, and if you have a registered dietitian through the hospital that's paid for by your insurance, that's very knowledgeable and willing to watch and read the information that's being put out there, that is cool. Because I can tell you now that most of the registered dietitians, and definitely all the doctors, if there are doctors that know about nutrition, don't really subscribe to new information. It's because just like trying to kick somebody off of a standard American diet and say, I want you to be a vegan. You're trying to push something that has been a staple of your life for a long time. It resonates with you. For me, growing up with my mom, she would make scrambled eggs, rice, and bacon every morning. And I'd mix that stuff up, finish it off, go upstairs. My brother wouldn't finish his, my sister, I don't know, and it would be great. And I'd walk off to the bus stop, and I'd be cool. And I'd be teased because I was the only Asian on the bus, except for my sister and brother. So that resonated with me. And some people, it's just hard to get that away to make a transition, but unless you're fed the positives of where this could be. So I always like to have patients understand that this is where we are now, and this is where it could be. And unfortunately, where it could be, if you're a standard American diet, is heart attack, cancer, and neurodegenerative disorder. And that's not cool. You just look around, see how many people are obese around you that are the same age or dying. And my roommate in college already died of pancreatic cancer. I've had one of my relatives had bypass. One of my relatives had a couple stents. One of my relatives had cancer. So, and I'm sure there's going to be more. That's just the statistics, and it's terrible. But that's because we buy into not changing. And unfortunately, we go into doctors' offices where they don't know much about nutrition. We just hammer, most of my colleagues hammer with the toughest stuff, which is medicine. And at the last ditch, I think medicine's good. But first blush, you should really consider changing your nutrition, changing your metabolic profile. So if you can have a little bit of metabolic flexibility, and I guess that depends on who teaches you this stuff, that would be important. Also, it's important to do the exercise, because even if you have a little bit of tolerance to different types of diets, if you don't move muscle, you're not going to be able to utilize that stuff. So you're missing out on one of the biggest. I've exercised since I was in grade school, sprinter in high school, bodybuilder in college, a little bit of a sprinter there too, martial artist, and I've kept it up. CrossFit, Spartan run. I just love being an athlete because it makes me feel good. Again, if I didn't have the knowledge of nutrition, I'd probably seek it out anyway. I didn't want to be a doctor. I wanted to be an athlete, but my mom forced me to be a doctor. I'm just kidding. No, she did actually force me to be a doctor. But anyway, now I'm here talking about nutrition and athleticism, and I guess it came full circle. So whether you're keto, whether you're a vegan, whether you're a fasting mimicking diet or intermittent faster or high protein guy or a carb loading athlete or just full semi-ketosis, there's always ways to improve. But bottom line is that if you're not getting the gains, you're not seeing any improvement, especially if you don't, well, first of all, you have to have a goal. If you don't have a goal, set it, because you're not going to notice the improvement, and it's going to be hard to stick to sustainability. Once you have a goal, if you're not making it, get some help. Registered dietitians, you got to feel them out. Some of them are good. I know 3 good ones in my area. I wouldn't necessarily go to an average one just because the insurance pays for it, because they'll give you average information. Just like my cardiologists give average information. So I love my cardiologists, my heart doctors for saving lives, but in the process before they save the lives, I don't know if I agree with all of them. In fact, I could probably run circles around most of my cardiologists. Sorry, guys. So just know that there's a lot of information out there. Try to digest the information on your own if you can. Otherwise, Dina, Taz, I'm going to help you get through this, but we're going to try to play around with this notion, try to use information, data to dial it in. First, prove it with getting metrics, dial it in, and we'll see what happens. For those of you who have other friends that are on the fence or getting stuck at a certain weight, please share this with them. I think having a group, if you can't afford a nutritionist, having a group like Weight Watchers or a largest loser group stimulates you and gets you in the game to either work a little harder, work 5 minutes more, put a little sweat in on Sunday, or just stay on track when you're really tired, depressed, and you want to have that cookie end of the night. I think being accountable to somebody else will keep you in the game, but know that you're not alone. There's always somebody who can help, and hopefully this gives you a little bit of a boost. So see you at the next clinic.